everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. And every week we are coming here with new information, new perspectives, meeting people in all different specialties to share their knowledge with us. We are so lucky to do this every single week. And this week we have a really awesome special guest, and I want to introduce you to Dr. Jeffrey Scott of Montclair Upper Cervical Chiropractic in West Orange, New Jersey. So, Dr. Jeff, so excited to have you. We're excited to dive in to all that you have to share because you're quite different up there in your neck of the woods.
Yeah, no, I'm excited to be on the podcast. Looking forward to the conversation. Yeah, and excited to dive into everything.
Yes. So I would love to ask you to tell us your story. What I always love hearing from people, what got you here in the first place? What was the desire to be in a private practice, to,
Mhm.
go in and go into this vein of specialty? So would love to hear from you first.
Yeah, absolutely. And I'll keep the overall story pretty brief. But I knew at some point when I was in college that I wanted to do something where I was helping people. So whether it was, and I kind of knew it was going to be something in the healthcare profession, most likely. I was fortunate enough, I had a mentor of mine who really exposed me to the more of the holistic side of healthcare, looking at someone's anatomy, looking at their body, trying to figure out what's not functioning right and what can be fixed, not just saying, hey, we're gonna, do this medication or we're just gonna, ice and heat and stuff like that. So kind of worked my way, and I found out that chiropractic in general was going to be the best option for me to pursue those goals. I always jokingly say that I was kind of the black sheep going into chiropractic school. I didn't have anyone in my family who was a chiropractor. I didn't know any chiropractors really. I had never been under chiropractic care, so chiropractic care was a little bit of drinking from a fire hydrant. It was a new experience, but it was awesome. So as an upper cervical doctor, I got into this specific area of chiropractic thanks to my boss, Dr. Kevin Pecca. I actually met Dr. Pecca through my first job. And about 4 years ago at this point, he was looking to bring on an associate, and I was at a point where I was ready to make a change in what I was doing, and stars kind of aligned. So here we are.
That is awesome. I love your story. It's always so much fun to hear. I think everyone's journey to their specialty is always unique, different. Um, sometimes stems from, their own injuries or things that they have dealt with in the past. So it's very fun to dive in to hear, what got you here. So thank you for sharing for us. And just because of the nature of what you do, I would love to hear diving into what are constantly people struggling with when they're coming into your practice? What are the things that they are really having a hard time with, and maybe the most common areas that you serve as well?
Absolutely. So upper cervical care is a little bit of a niche in within
Yeah.
the chiropractic profession. So we tend to get a little bit of a unique diversity of people. I usually break our patients into like three categories. The first is, basic musculoskeletal complaints. We see patients with neck pain, shoulder pain, I would say tension, headaches, musculoskeletal complaints. That's obviously bread and butter for the chiropractic profession as a whole. We also get patients who have a lot of vestibular issues. So that's a little bit different, but I see patients with varying types of dizziness, vertigo patients, off balance, lightheadedness as well. And then the other group, I kind of put them in more of our neurological type patients. So that's patients with trigeminal neuralgia, suboccipital neuralgia, radiculopathy, and then you kind of have like migraines and stuff that kind of get sprinkled into a couple of those different categories as well. So we do see a variety of patients. So it's always interesting and exciting to see who we're going to be working with and what they're dealing with.
Yeah, it seems like, more often we're definitely talking about more upper cervical
Mhm.
issues.
Yeah,
I just want to kind of double tap on that.
yeah.
Why? What is happening to everybody? Why is this such a common problem that I feel like I'm talking to a lot of people about and would just love to know from your perspective what you're seeing, whether it's occupation or something that we're just doing every day that's just not right or things that we can be aware of.
Absolutely. So I think there's two ways to answer that. The first is, with anything in healthcare or kind of like stuff in society as a whole, like the more focus or research kind of that goes into it, the more that tends to become a common topic, or at least that I find. So I
Yeah.
wouldn't be surprised as more people are kind of across healthcare disciplines are saying like, hey, wait a second, like we're getting more research on like the benefit or the input of proprioceptive information into the vestibular nucleus from the cervical spine, cervical instability, what's going on with the ligaments around the upper cervical complex, things along that nature. Upper cervical chiropractic area has actually been around since the early 1900s. It's actually for the longest time what most chiropractors were practicing. But as the profession grew and diversified, it kind of it became a little not as prominent. A lot of it, I think, has to do with having to master the X-ray analysis. But now, as upper cervical care has grown, we've had the ability to market what we do, and with kind of advancements in technology that allow us to improve our own assessment, I think it's becoming more prominent in the public domain overall. But yeah, upper cervical area in general, we find a lot of times because there's no disc space in that area, it's also where 50% of your rotational capacity in your neck come from. It's more susceptible when you have an injury. So concussions, whiplash, slip and fall, even like prolonged periods of stress and abnormal muscle tension can really impact what's going on in that area.
Yeah, for sure. And you touched on this just a little bit, but would love to dive in a little bit to how your approach is so different. So whether there's certain things that you're doing in the office, different modalities that you have that have been
Yeah.
very successful. Would love
Mhm.
to hear what makes your approach so different than maybe other people, when we think about chiropractors or
Mhm.
when we think about, other people that are in your field,
Mhm.
you are definitely so niche. And so I'd
Yeah.
love to hear a little bit more about that.
Absolutely. So, kind of as the name of the practice entails, like we focus mostly on the upper cervical spine, and that goes with the treatment, analysis, and management of that area. So, chiropractically, what we're looking to say is, hey, what's going on with that area? What's going on with usually the first like one, two vertebra in the neck? We look a little bit lower. Other upper cervical docs stick with C1. But what we're essentially saying is there something structurally going on in that area that is leading to mechanical neurological compromise? The best analogy I like to use is if most people have sprained their ankle or know someone who sprained their ankle at some point in time. Well, everybody knows that you sprain an ankle, the joint's injured, but there's a cascade effect that comes from that. You start to limp, your calf muscles get tight. If it let be, your knee starts to bother you, your hamstring gets tight, and before you know it, you're like, all right, a month later, you're like, my low back is screaming. Why? Well, it started as an ankle injury. The joints in the neck are no different. They can get injured, they can get fixated, they can get inflamed. The difference is they're smaller and there's just more of them. But so what we do are the big thing that separates us is we have a 3D X-ray machine called a cone beam CT scan, and it's been pretty prominent in the profession, or it's becoming more popular over the past 5 years, I would say, maybe a little bit more. But that's really not only is it a great analysis tool for us because we're seeing everything not only in a 2D image, but then being able to see things globally in a 3D image. It's also a great education tool for the patients to be like, hey, here's what your cervical spine looks like. Here's what your jaw looks like. You can kind of people get a better appreciation for what's going on, and it just allows our analysis to be more precise.
I love that. It's like taking your car to the mechanic. And
Mhm.
don't you hate, I mean, when they just tell you what's wrong, but you can't really see it, you don't
Yeah.
understand. And then you have one of those stellar mechanics that are like, here, let me actually show you. Why don't you come into the shop and see this and this is what it's doing and this is how we can fix it. And then you're like, okay, that makes a lot of sense. I see the damage now.
Mhm.
It's not something that I think is maybe just there or I don't know. It
Yeah.
kind of demystifies
Absolutely.
some of what is happening. And I think when patients can understand what's going on with them, they're more likely to fix the issue.
Yeah.
Um, and be excited to because now they've identified you've identified a clear problem. So no one likes confusion these days.
No. And it's a great, a lot of what we do too is because it's different, we're doing a lot of education with patients and trying to explain to them to make it digestible. So that's where the x-rays are really beneficial because I can show someone like, hey, like, see how it is actually positioned. And then the really cool thing is, we've had some patients that have been under care for a while and we've actually re-x-rayed them and I can
Yeah.
show them, hey, look, like, the curvatures in your neck have changed. Like you were kind of going in one direction, everything's much more midline. And that's also really cool that they can see, like, hey, my body has healed not just symptomatically, but also structurally.
Yes, 100%. I love that. I think anything that you can do to educate someone for them to learn better or make change is
Mhm.
fantastic. And one of the things I love asking on this podcast, because I think a lot of people, once they hear things, in the day and age of Google and ChatGPT, we look up everything, right? No more dictionaries or encyclopedias. We are constantly looking up things, and it takes us 2 seconds, right? But not everything that we read is factual
Mhm.
or maybe a good use of our time,
Yeah,
or not explained well
yeah,
online, or really don't match up to what your symptoms are, and then you think you have stage 4 cancer, which is
yeah.
also not true.
The
So
WebMD rabbit hole, yeah.
yeah, the WebMD, grab all information. So, that being said, there's a lot of misconceptions, I think, with every specialty. I think people
Yeah.
hear gastroenterologist, they hear a chiropractor, that, there's all these things that they associate with different specialties. What do you say for you are some of the common myths that maybe people come in and ask and say, oh, do you, I've maybe been to a chiropractor before because you guys are very different.
Yeah.
How do you debunk some of these myths and what are they that you get asked all the time?
Absolutely. A lot of times, so for a lot of times for us, we're usually kind of towards the end of the gauntlet, the medical gauntlet. So usually when a lot of times when unless it's a direct referral, people are kind of they're finding us online or on social media, like they've been dealing with some of this stuff for a while. So
Hmm.
a lot of times it's just explaining, hey, here's what kind of like I was just running through with you. Here's what we do, and here's why we do it. Here's how it's different. I mean, chiropractic in general, the general notion is, oh, you're going to crack my back. That's like, that's kind of the general, like, the in the public joke. So actually, the way we adjust people or treat people, there is no bending, there's no twisting or cracking or popping. It's a very, very specific, very light adjustment. So that's one thing I educate patients on. I think the other thing is, trying to think just like general questions like, oh, why are you going to do this, or people want it to be explained to them, or like I heard this. A lot of times what I'm telling people is, okay, like, not that like your other chiropractor, your physical therapist was doing anything wrong if they didn't weren't getting better. I just said, hey, there might actually just be something that wasn't picked up on the analysis.
Hmm.
And for us, our analysis is more specific for a given region, than it might be for another provider. And so that's where just showing them like, hey, like it's not that this wasn't the right thing. It just might be there's something else that needs to get fixed. So
100%. No, I love that. I always think it's nice when people can, again, dive in, explain a little bit more, educate, and in the name of all that, and continuing on what you've been doing such a great job in this interview about is education. And so I'd love to
mhm,
hit on 2 more points, actually, one for patients, but also one for providers. So it's
yeah.
kind of an interesting two-pronged question is I love to ask people their advice.
Mhm,
What are some pro tips that people can take today? Obviously, you're helping people with their upper cervical health. You know,
mhm,
what can we do right now? Whether it's something small we can implement every day to make that
yeah.
just that much better. And then something that you have found doing in the practice that has really helped you. Maybe it's just the way you've taken care of patients or a piece of technology that you use every day that you're like, man, this is such a game changer. If everyone could adapt this, or you could try to adapt it, it would change your life. So One for patients, one for practitioners that are watching. Would love to hear your input of what
Absolutely.
your pro tips are. Yeah.
So pro tips for, I'll start with patients. So just in general, I mean, one of the most important things is moving around. I just, and that kind of gets more, not necessarily chiropractic, but just in general, movement, exercise, keeping active. Like your joints are meant to move, your body's meant to move. The more rigid and kind of more complacent we get, like you're going to start loading things differently. That's just going to lead to more and more problems. And it's a conversation I have with patients all the time. Um, Also for patients too, just in general, like depending on what you're dealing with, like if it's been going on for a while, or it's been reoccurring, get it checked out. Whether you come see an upper cervical chiropractor, a more traditional chiropractor, or physical therapist, like don't let symptoms linger because we like to say if you listen to your body when it whispers, you don't have to hear it scream. So like get like if you've got even like nagging low back pain that's kind of been like it's been going on for a couple of weeks now, like go get it checked, like get because there might be, if you get it fixed earlier, then it doesn't become a chronic condition that takes longer to heal.
Mm,
um and with that said, like I get a lot of patients, like I said, who have been through the gauntlet. Never stop advocating for yourself. And if you're a patient, like if something's not feeling right, keep advocating. Hey, this isn't improving. And I usually tell patients if they're going to check in with another provider, like, hey, if you have questions, tell them this, ask them this, like get the information you need, but just ask more specific questions because a provider is going to say, I can answer that, as opposed to if it's a 30,000-foot view question, well, there's a lot of variables that are having to be considered.
sure.
But never stop advocating for yourself, and never stop looking if you think something might be an option. Your good providers are going to try to be as honest and practical with you as they can. Um, with that said, for providers, that is a little bit trickier, just because it depends on how you're practicing. I mean, obviously, I would say for chiropractors in general, much like you said, a good mechanic is gonna say like, "Hey, let me show you what's going on underneath the hood." Personally, I kind of think having those X-rays is valuable because I've had some patients where they're coming in with like headaches and certain conditions, and I've X-rayed their neck, and their first vertebra in their neck is congenitally fused to their skull. I should not be putting a force into that segment. The mechanics have totally changed, and if I were to have done that, one, if I never X-rayed them, I probably wouldn't have found that out. Two, if I were to have treated them with that, I could have made them feel a lot worse. So it's
Mm.
good to kind of see what's going on. And even if you're in a practice where that's not set up, don't be afraid to, like, if someone's not responding, don't be afraid to get the x-rays. That's just personal from what I've seen. Now, obviously, there's different types of chiropractic. So, but if it falls in your wheelhouse, when in doubt, see what's going on in the spine. Like, it just gives you better information to work with.
That makes so much sense. I mean, I love both of the key points of advice that you gave to not only the patients, and I love advocating for your health. I think
Mhm.
sometimes we can get, you meet the wrong person, you get shut down, right? And I think that is difficult on your journey when you're in pain, but then also at the same time,
Mhm.
don't wait too long. You
Yeah,
know, start it while it's small before it becomes, you maybe you had a pebble thrown at, the glass house instead of, the giant rock that's tumbling down the hill coming for you,
100%. Yeah.
Yeah, I think we all, especially today, we tend to ignore things. Life is fast, things get in the way, we procrastinate with our health.
Mhm.
But it's a really good reminder for everyone to be proactive about it
Yeah.
because it can get worse. And what if you could just deal with it now when you aren't crying in the middle of the night, rocking like a baby because you have back pain. So,
Exactly. Exactly. Yeah.
yeah,
If
and I
you get
love
on top of it, it usually gets, chiropractic works. What most people don't realize, chiropractic care in general works really well, really, really well for like acute and subacute conditions. So like couple of days, couple of weeks, like it works great with chronic conditions too, but there's a lot more like time, patience, and stuff that can be needed when it's been multiple months, multiple years. Like you can treat something in that acute or subacute phase, it usually recovers a lot faster, obviously, depending on what you're dealing with.
I love it. Dr. Jeff, this has been terrific. I loved hearing from you today. So much great advice and education and things for everyone to take home and to
Yeah.
think about. And before we leave off today, I would love if you could share with us, where folks can reach out to you guys, how they can touch base, website, phone number, socials. This is your time for your shout outs.
Absolutely. Usually, so we have a couple areas to reach out to us. We have all of our information is on our website, montclairuppercervical.com. Patients can also, if they're really interested, they can also self-schedule new patient appointments on there. They can also reach us. We are on social media at Montclair Upper Cervical on Instagram, and then my personal Instagram is Dr. J.R. Scott, so Dr. Scott on Instagram as well. So those are three of the best areas to reach out to us, and they've got all of our information covered on those areas.
Cool. Awesome. Well, Dr. Jeff, thanks so much for joining us, and we hope to have you on very soon again.
Absolutely. Thanks for having me. It was a great conversation.
Same here. Have a good day.
You too.